Kent MP wants all hospitals in Kent to have more specialist psychiatric teams to help patients admitted at night. In October, we reported how the liaison psychiatry service at East Kent hospitals was being scaled back to the hours from 8 till 4. Faversham and Mid Kent MP Helen Whately, who's also on the Commons Health Select Committee, wants the service restored and is speaking to the commissioners who control the local health budget.
What I am working on is encouraging the CCG in their contracting round for the next kind of financial year from April to make sure that they commission for a full psychiatric liaison service. I'm also writing to the Minister to make sure that the government funds that, because in the spending review, in the Chancellor's autumn statement, there was a commitment of much more money for mental health, so I want to make sure that that goes, among other things, into psychiatric liaison.
Nick Fairweather is a solicitor in Whitstable who specialises in cases of medical negligence, and he joins us now. Morning, Nick.
Good morning.
How many cases have you come across that involve the lack of mental health staff or quality of service in A&E?
Well, tragically, John, too many. And I can't stress too much what an important frontline service this is. Because people presenting in A&E with mental health problems really need proper care. And usually the acute teams there will not have the specialist knowledge to be able to assist them, assess them, and make sure that they're either admitted into psychiatric care or they're properly supported in that position.
And it's only available between 8 and 4, is that right?
Well, it's absolutely ridiculous. I mean, people. This is a service that needs to be provided 24-hour. It needs to be provided during night times and particularly over weekends. And a service that finishes at 4 o'clock in the afternoon is really not much good to anyone, I'm afraid.
Well, I suppose their argument is that the crisis team is always available and they're called out if they need to be.
Well, the problem with that is the crisis team has many demands on its time. And I'll give you an example from one of my cases. Peter Franklin died in August of 2013. And he attended Maidstone Hospital 4 times on the day that he died. And he attended Priority House, the mental health service, 2 times. And the last time he attended A&E, he was taken there by a taxi driver who took him from the bridge over the M20 and took him back to Maidstone A&E and said, look, this guy's suicidal. He's told me he is. He desperately needs an assessment. Now, A&E then called the crisis team. The crisis team wasn't contracted to the hospital at the time. They had other things to do. And Peter was sent home, having attended 4 times in his dressing gown, behaving bizarrely, and he then went straight back to the bridge that he'd been delivered to the hospital from by the taxi driver, and the taxi driver had given that warning, and he took his own life. So what's important is that you have a specialist embedded service with a specialist mental health professional there who can be there on hand, not at the end of a call and people waiting for 18 hours in police cells or A&E or whatever it might be. Someone needs to be embedded there and readily accessible to deal with those kinds of situations.
Yeah. Now, Helen Whately seems to be suggesting that the money is there, it's available, it just needs to be spent in the right areas.
Well, I mean, we hear there's more money available, and money was distributed in October by NHS England to the commissioners. But I really have to say, John, you know, what are these commissioners doing? Where are they putting this money for mental health that they think is more important than having this A&E liaison? And it reverberates throughout the public sector. The police are having to hold people with mental health problems in police cells. You know, acute hospitals are meant to be dealing with acute physical emergencies, and they're having to house people. So it's bringing a strain on the whole public sector, unfortunately.
They have sent us a statement. I just want to read you the statement they've sent us, Nick. It says, this is a joint statement. The CCG and the Health Trust told us liaison psychiatry is an important service and they're working together to develop the best service in the future.
Well, what does that mean?
I don't know. I thought you might tell me.
Well, I mean, it's just you know, if they seriously think that this service is adequate, provided between 8 in the morning and 4 in the afternoon, then it's ridiculous. It's absolutely ridiculous. And anyone working in mental health, any psychiatrists or nurses or other professionals working in the mental health area will tell you this. This isn't a contentious thing, and it's breathtaking that they think that this is a proper use of the money that they've been allocated. And I don't know what these extra sums actually mean, but you know, we're being told, presumably in good faith, that there's more money available for mental health services. The government's talking about parity of esteem mental health services with other services, and yet here we are with this frontline service being pulled back. And you know, it's just extremely worrying. I mean, I can give you another example. Simon Wilson, another of his family is another one of my clients. He died at the Kent and Canterbury Hospital in January 2010, and he was there for 6 hours waiting for psychiatric liaison, and took his own life actually in the clinical decisions unit at the hospital. So you know, this is a really serious matter, and I can't believe that they think it's acceptable to be pulling back this service at this time.
Nick, thank you very much indeed. Nick Fairweather, a solicitor based in Whitstable, specialising in cases of medical negligence.